Well, like so many serious conditions, just knowing about DVT is important. That's deep vein thrombosis, often referred to as blood clots. And helping us elevate awareness today about risk factors, prevention, and treatment, nationally renowned physician, Dr. Steve Lamm. Good morning, doctor.
Good morning, Mike. Thanks for having me.
Thanks for being here. What are some of the earliest signs of DVT?
Well, first of all, just let me tell you, 500,000 to 1 million people either get a clot, 100,000 people die of a pulmonary embolism. These are clots that are generally starting in the veins, in your leg, in your pelvic area, although they can actually occur almost anywhere. And these are clots. The clots dislodge and they travel through your heart to your lungs, cause injury to your lungs, and unfortunately in 90 to 100,000 people a year, it's called a fatal pulmonary embolism. Very common, unfortunately. There are a lot of known risk factors. Just being 40 and older is a risk factor. Being overweight, 65% of our population are overweight. Being a smoker, having trauma to your legs, having any kind of operation. You go to a hospital and you're lying in bed for any period of time, you're at risk. How about getting into a car and you go cross country, because you want to see the beautiful America, or you want to get into a plane and travel cross country? You're in a plane for 4 hours in a cramped environment, or you're traveling to Europe. As you can see, a lot of people are at risk for having deep venous thrombosis, and the problem is that it's really the tip of the iceberg, because only half of us actually notice that they're having pain and swelling in the extremity so that the doctors can diagnose it and treat it. How about the half that don't even know? In other words, you go into the hospital for your gallbladder operation, and all of a sudden you get short of breath, you get an arrhythmia, and then you can die not of the gallbladder surgery, but of the pulmonary embolism. Yeah. So just raising awareness, the physicians already, believe me, if you're in a hospital, they know you're at risk, and they'll put those compression stockings on, okay? If you're, for example, traveling in a car or a plane, so put on compression stockings. Maybe take an aspirin if you know you're going to be traveling for protracted periods of time. Get out of your car, move around in the plane, especially if you're on the window side where it's a little bit more awkward. You don't want to disturb the person next to you. Trust me, disturb the person, get out, walk around in the aisle, do some stretching. We're all in some ways, as a result of our lifestyle, at risk for these clots.
Yeah, sometimes it's scary, and occasionally you hear about these cases.
I mean, and once again, on the prevention side, very simple thing are these compression stockings. They're actually quite attractive these days. Actually, we have two models that are just, you can't even tell that they don't look like they're medical, stockings. They're just normal appearing stockings. So I think that there's stuff you can do. And by the way, the stockings that you get in the hospital are created for lying down, and then the ones that you do on the outside, are a little bit more, whatever it is, they have a band so that it's easier, and they will stay up. But walk around, if you can lose weight, which of course is a whole other challenge, not to smoke. I mean, these things are really important preventive strategies.
Yeah, what other treatment options are out there if maybe you're diagnosed with
Well, if
DVT?
you actually have the clot, first of all, you diagnose it by doing an ultrasound. Or a lung scan if you think it's already in your lungs. And then there are anticoagulants. I mean, there are very sophisticated new medications. Of course, every medication is fraught with some potential complications, but these anticoagulants that you take for a protracted period of time, sometimes even for a lifetime, depending on your own, your coagulability, can really make the difference between dying and surviving. Yeah. And of course, there are local treatments you can for the veins in your leg, because sometimes as a result of these clots, you injure the valves and then you get this chronic low-level inflammation. Where there are now some intense treatments, compression stockings once again. There are a whole host of treatments that you can do. Walk around, have a standing desk as opposed to just sitting in the traditional desk where you're compressing the veins all day long.
Yeah, I've been thinking about that too, getting a standing desk. Where would you send our viewers online if they want to learn more, doctor?
There's so much, the NIH, NYU Center for Thromboembolic Disease, the Cleveland Clinic, Mayo WebMD. There's so many wonderful sites.
Yeah, just being aware of it and doing some research on your own is a good idea. Doctor, thanks for your time this morning.
Correct. My pleasure, Mike.
All right, up next, Ray Scott performs live in studio. The deep voice country star impressed us during his last visit with both his vocals and his sense of humor. He'll join us right on the other side of this break.